All right, everyone. Hi, I'm Dr. Saurabh, and I have with me a great achiever who has scored Dr. Prannya Arora. She has scored a magnificent rank in this year's INICET 2023 November, rank 36. Many congratulations to her and her family. And I'll leave everyone with everyone to introduce herself, and she will tell from where has she started her journey, what has she done, and how is the feeling right now. Congratulations, Pranya. Over to you.
Thank you so much, sir. Hello, everyone. I'm Dr. Prannya Arora, and I'm a resident of Delhi. And I did my UG from Lady Harding Medical College in Connaught Place, Delhi. And I was of 2017 batch of Lady Harding. I completed my internship in April 2023. And I gave my first attempt at NEET in March whilst my internship was going on. So I could not really study for that. But I got a decent rank of 7,000, around 7,000. And then I gave an IIMS in May, my first attempt. Again, not a very good rank, but 8,000 I got, around 8,000. Then I gave my TNDs. I started TND batch with DAMS, and then I gave this INICET as my first proper attempt, and I got a a good rank. And the kind of feeling right now, I think I'm feeling on cloud 9. I mean, it is this feeling is out of the. I cannot even express it right now.
And you told me that you got this result on Diwali, right? And you were in a lift when you got this news. Tell us about that.
Yeah. So actually, it was Diwali, and we were going to a relative's house for Diwali. So I had a bunch of gifts in my hand, and I was in the lift. So my result came up, and the notification popped up. So I was like, "Nee, I won't open it right now because my mood will be spoiled because I don't know if I done." I was my sister, so she said, "Koi baat nahi, open up. It's okay. We'll see about it." And I opened up, and I was like speechless, and I started crying on that, and all of my family started crying. It was a very emotional moment.
Yeah, I understand. So Pranay, you told that you did TND after internship. So TND was the only thing you did, or you started with your preparation early in MBBS?
My journey with DAMS began in my third year, my pre-final year. I joined the 3-year course, the offline classes at Karolba. So
foundation course.
In my a foundation course, yeah. So in my third year, I did the third and fourth year. Unfortunately, we were the COVID batch, so the COVID hit, and we were forced to sit at home and attend online classes. But then I would definitely recommend offline classes than online because I'm a very lazy person. I procrastinate a lot, so I would better go to an offline class. But then I did my final year and third year subjects in third year with DAMS. And my first and second year, I did partially in my final year and partially in my internship phase. I could not do a lot of TNDs in internship, honestly, because internship was hectic at Harding. So after that, I attended my DBT although in internship session, in internship wala time. But I could not complete it because of internship was heavy and stuff. So I did my partially DVTs in my internship, and partially I finished them after my internship, like in this phase when I was doing the TNDs.
So after you started your preparation in third year, okay, and you completed the third year subjects in third year, and then the final year subjects, as well as the first and second year you did in the final year. And then you had the notes, a bunch of notes which you revised. And during internship, you were able to revise those notes. And what about the grant test and the MCQs? When did you start giving grant tests?
Sir, very honestly, I started giving grant tests for the first time. I gave it before my NEET, the first NEET attempt. I gave it, second grant test, I think I gave it before my NEET attempt. It was not a very good attempt, although. I did not score very much in that, but it was a decent attempt. And after that, I have been giving grant tests regularly. And I have followed the question bank regularly after that, in my preparatory phase. I did not do it in my final year and stuff, but then in my preparation phase, I did that. And I would just, Abhi, you just said, I would like to, enlighten upon something. I would like to say the notes for the preparation, for someone who's going for preparation, the notes should be finished before the internship. I could not finish that, but I would say I would recommend to finish all the notes at least before internship, so you can revise the notes in internship. And also, as I said, revision. I would say revision does not begin just after you start a preparation. it begins in the final year itself. I mean, when I made my notes with DAMS in third year, I revised all my medicine notes and surgery obs-gyne notes in final year itself. Like multiple revision happened in final year because of the profs. So I think it starts itself.
Yeah.
That's, I think.
So you two things I want to ask regarding grand test. You first grand test. What was the correct number of correct questions you scored? And you said you started giving regularly. What do you mean by regularly? How regular you were with grand tests?
No, sir. The first score was not very good. It was around 110. I think 115 was something like that. The correct number of responses were this thing. After that, after my when I started doing properly, I gave it around once a month in the beginning, and after a few months, I began it like twice a month. And I think Deepthi ma'am used to post on her channel also like about how to what is the frequency you have according to the number of correct responses you're getting. So I think that helped a lot. So according to that, I was getting in the end. If I just tell about the marks or something, I would get first it was around hundreds. Then it increased to 120, 130 something. It was 140, and towards the end, it was 150 to 160. This range was there in the end.
Means the number of correct questions were about 150. Maximum you got 150 to 160, and you started with 100.
Yes, sir.
So that is what the many students when they start giving GTs, they get 100 GTs, and they get that they are not able to do it well. The gradually only the grand test number of correct questions will of course gradually increase. You won't get 150 corrects on the first grand test, right?
But I would like to say something. I was always scared of grand tests. Like, I always felt I feel demotivated after giving a grand test. Like, I won't score good and I would feel like demotivated. But that's something I would say is a wrong approach. I think someone should, overcome their fear and give a grand test. Even if they score like very pathetic marks, but then they should give one because you'll know where you stand. And then you can improve from that. You can build up from that.
Absolutely.
So I think that.
I also say the only parameter of PG exam preparation is the grand test. Grand test will tell you where are you standing, how the preparation is going.
Yes, sir. I mean, you can learn a lot from a grand test. Like, I mean, time management you can learn, and even guessing skills are built up from the grand tests, I feel.
So how did you? I mean, after giving grand tests, how did you evaluate your grand test? Means you got 100 questions correct. What about you were able to? Did you see the entire 200 questions again, or only the incorrect ones? How did you cope up with the grand test?
Entire 200 questions. So example, if I had some question right, so and I know the concept also.
Yes.
So I was like, okay, I have it right. Concept was right, just that much. Then if I had a fluke, maybe if I just put a fluke, I would see why did I put a fluke? Actually, I did not put flukes just like that. I had to think also, why? It was an informed guess. So why did I put the guess? Was my intention right? Was my approach right? And the proper justification, proper reasoning of the question, that. And the wrong ones, so I definitely had the topics and something. And there was a very good approach by Deepthi ma'am on YouTube, I think, about how to go about column approach. Like, you had this thing like concept based wrong hai, ya fir, like you did not have information about this. How to go about this? Concept building, go back to the concept, review the concept again. And if it's like some information is new, add the information to the notes. And the ma'am had a very good approach to that. So I think I would recommend to watch the video if someone's watching.
Correct. So going with the preparation only, what was the last, you got a very good rank, 7,000 rank in the first attempt. That is also not a bad rank. And many would have taken a field and they ended the journey. Yeah. It was a very difficult decision for you to not to take any branch and then continue with the study. It must have been a difficult time. Of course, that is a very courageous thing for you to do. And what was you can elaborate on that. And the next question, leading question is, at the end of the preparation of INICET or any exam, what was the 1 month, what are the things you did in the last 1 month or 15 days? Tell us, show us light on that as well.
Sir, I would say first of all, yes, it was very difficult to overcome that fear of not taking up a branch in the first counseling itself. And I would say it was really worth. I mean, it was very, it was really weird. Like, the people around you, with similar ranks or even more ranks than you are taking up branches and, getting settled in their careers, who are still, uncertain about what in the future. But that fear remains. I think fear just propels you forward. So I think the last month strategy was something like, yes, the revision is very important. Although building concepts in the first go is utmost important, obviously, but then in the last month, I think I followed majorly DVT, which I attended in the internship.
Yeah.
And in the INI, the NEET and INI, the first attempt, I did DVT very properly. Like, it was like the gold standard book for my last month. Okay. Because it was very informative and the high points were very, very clearly mentioned, and the previous topics as well. I remember I was very afraid of surgery. I used to be afraid of surgery, GIT especially. And I did GIT from like that source before my INI. And the questions were very repeated. Like there were 3 questions repeated, जो मुझे याद थे, वहीं पे at the moment. So that was very nice. And in this INI, there was PYT sessions in DAMS, which were like they were marvelous, amazing. Because I remember there were straight questions from that. I remember Siddharth sir in a PSM video, he said once, कि ये question last time आया था, तो ये ना अभी आएगा. And I was like, how can someone predict that? And it showed up in the exam. I was, oh my god.
Amazing. Of course, Siddharth is a great mentor, great teacher. So coming on that, who other faculty during your classes from online and offline do you remember from T&Ds and foundation? Anything
so I think all the faculty,
or anything when you were giving exam, and then one example you gave, anything in exam you said, "Arey, I heard in the class," or this was the one which is just striking me.
Even this INI also, a lot of things happened. I think I could, imagine Tushar sir saying next patient, OPD next patient, please, for the question that was there. Right. A lot of things were there. I mean, I could imagine Sachin sir doing his actions, abhi like, sir used to do an approach for thought insertion, thought withdrawal, and thought broadcast. Aise kuch, sir used to like explain with actions. So I could imagine his actions ki thought broadcast ye tha. And even a lot of like every faculty, I think, every question I could imagine something or the other. Yeah, I think he taught it somewhere and I heard it somewhere. So I think, a lot of things were there. But I would like to share one incident, which I think motivated me a lot. In my TND, when I was giving my TND, I went to ask a doubt once to a faculty. I won't name the faculty, but then I went to ma'am and I did not know it was a good doubt. So I went to ma'am and I said, "Ma'am, ऐसे है." Ma'am was like, "Oh, that's a good doubt, yeah. I mean, you have a very good concept. Why don't you go for INICET?" Ma'am, I'm preparing for that, but I'm not sure if I'll crack it or not. And I didn't remember that incident because I did crack it.
That's nice. So, you said you were preparing for INICET. Did you really prepare for INICET or your main aim was NEET? Was there a different strategy?
I think yes, sir. My main goal was basically to NEET. But then I was preparing. Actually, it was like I was giving INICET, so I thought I should just prepare for like this in the last 1 month. And if it happens, well and good. If it does not happen, I'll just go for NEET in a different way. The strategy I think you should follow is, so INI has a very peculiar pattern of asking previous year topics. But not the questions, the topics are very important. So I think in the last month, the focus should be given on those topics particularly. And the pattern of INI is clinical first of all, and they have a tendency of asking clinical questions. The clinical vignettes are very important for INICET more than NEET, because NEET gives us more of straightforward questions and very little vignettes. Very small clinical questions. But AIIMS has a tendency of asking clinical ones. And one thing I would like to say is people are afraid of INI exam because they think it's out of the world. No, it's not. It is actually a part of your curriculum and syllabus only. And the pattern of time management, I think, is very important in INI. Yeah. Because it has recently changed also in my exam only. So I would like to tell something about that pattern. I think if ma'am and sir put up a video before the INI about how to go about the pattern. But I'd like to just share a little of my insight on that. I think we had 50 questions and 45 minutes on that one set. And personally, I like the approach because I feel when one set is done, it's done. Nothing else is, you cannot review it and you cannot go back. So it's just done. Your mind is clear of that set now. Yeah. Secondly, the time management, I would like to, tell us that in 30 minutes or 35 minutes, I would say, I just review all the questions once. Even if I answer or don't answer, I'll just have a look about all the questions. I'll just go through all, And if I could answer, obviously I'll answer. But I'll not waste the time on one question or, just get stuck on one question. But in 35 minutes at max, I'll just review all the questions. So that I have 10 minutes ample of time left so I can go back and review the questions again. And secondly, the mark for review thing in AIIMS is a very catch point. I mean, people should not, in AIIMS, you should not mark for review. Maybe you can write up on the back of the admit card or something that you have to review these questions, but don't mark for review because it's a very bad feeling where you have left those questions and they don't get considered in the.
They don't consider mark for review.
Yeah. Right? Don't go for that risk, I think. Mark it right now, write piece of paper, and just go back after when you have time for that. That I think is the difference between IIIMS and NEET.
So how many questions did you attempt this time?
So in this attempt, I did 189 or 190. 190, I think.
Okay. And how many corrects do you think approximately you must have got?
So I think I did not see the record actually, but I think 160 plus. I think I got 160 to.
And was there a resemblance with the did you give CBT as well?
Yeah. Yes. I would have definitely. I forgot the point. The CBT was amazing. Very coincidentally, I had on my birthday also. I gave a CBT on my birthday. So, I would say CBT was really helpful in that. The exam pattern, the questions, the time management skills, and the CBT rank I got was approximately the same only. I got 51 rank, I think, with CBT.
Yeah, nice.
What else in CBT?
You were talking about CBT, the CBT INICET one.
Yeah, the CBT INICET, which was just 2 weeks back on 18th, I think it was.
So similar rank you got in CBT, same number of questions you attempted, same number of similar marks and similar rank. Okay.
Yes, sir. It was actually the same pattern also.
It was on your birthday. And, and you gave the exam on your birthday, right?
So again, I was giving my room, and my cousins were waiting outside my room to cut my cake, and I was like, wait, I just give my time to come out. But I think it was worth it, I think.
That's great. Okay, so last quick things for the students who are listening. You started preparation in your third year. What about the first and second year subjects you told that you did in final year? So now, what do you think? And you got a pretty, early rank. You got a good rank with internship as well as you did it INICET in almost the first attempt, but not almost the first attempt because it is just 5-6 months after internship. So what advice in the last you will give to students during MBBS when to start their preparation for NEET and how can they and what should they prefer, offline, online, or a mixture of them? And what about the T&D? When should they start T&D? First, when they start preparation, and what is the advantage of T&D? When they should start doing T&Ds?
Sure. So first of all, regarding preparation, if next is coming up, I think they should start in second year itself because they can finish their notes by second and third year, and they can revise thoroughly by final year. That I feel for next. And if NEET is there, then NEET is there and INI is there. So I think third year is sufficient.
All right.
If someone wants to start in second, fine, but then third year is sufficient because third and final year, they can finish their notes very well. And in internship, they can just review the notes and it will be very easy for them to crack because the concepts are very fresh that time. And regarding first and second, I would say it is better to make concepts. That's the base of the third and final year. So I think it's better to make up concepts in first and second year and then go about doing things in final year.
Right.
Regarding TNDs, I would recommend all the students to give it an internship itself. I could not give it, but after that internship, I realized a lot of my friends did give it, and they secured good enough rank in NEET as well. So and it was not very hectic also. If you cannot give offline TNDs, you can go for online also. Like in internship, it's hectic. You can go for online TNDs also. And I would like to say, do attend DVT in your internship itself. That is something I did, and that was a very good thing in my preparation. What was the third question, sir? I forgot.
Yeah, that was one. Just to concise, you told, very methodologically that you started doing your notes during your second and third year. and then T&Ds, maybe in internship you do T&D, and at the last, within 1 month of preparation, you attend DBT, but you revise the DBT and the previous year questions and topics during the last 1 month. I think that should be the good enough message for the students who are listening, how to go on with the preparation. It's very simple and a basic thing. I mean, if you do a lot of things, that is not going to work for you. If you go methodologically like what you did, and you're going to get great ranks like you did.
That's enough. Just don't go like running down here. Follow one source, just do questions meticulously and give GTs, review yourself. Don't fear away from questions, doubts. Don't fear away from doubts, and don't fear GTs and tests also, like subject tests also, and review them. And I think that will be enough. It's not a very big thing.
Right. So last question before we wrap it up. You got a very good rank. So which branch are you aiming for?
So I've not really narrowed it down yet, but I'm going to go for, I think, non-surgical branches, maybe medicine or pediatrics.
Okay. So medicine you will easily get, right? Of course.
Yeah, I think AIIMS really has a little less seats, but I think I'll get it in PGI Chandigarh.
Yeah, of course.
I just hope I get it.
Yeah, that's why you left 7,000 rank in NEET. It's great. Great talking to you, Prannya. Congratulations to you and your family. Anyone in your family who is a doctor?
No, sir. I'm the first doctor in my extended family.
Okay, congratulations. So very well done. And good that you told your journey, how you got about. You gave your CBTs and on your birthdays, you got your rank on Diwali. You're going by celebrating good. Okay, I hope you're not giving NEET now, right? You're going to start your residency 1st of January, I think.
Yes, sir. I definitely joined the seat in January itself.
Right. So congratulations once again. Thank you for coming.
Thank you so much, sir.
And best wishes. Keep in touch.
Thank you.
All right. Good, Prannya.